How does HPV testing help reduce HPV transmission risk? Imagine catching a silent intruder before it causes harm. That's what HPV testing does. Human papillomavirus is a common virus spread mainly through skin-to-skin contact during sexual activity. Most people will get HPV at some point, but often it clears up on its own without any symptoms. The tricky part is that some high-risk types can stick around and cause serious health problems later, like cervical, anal, or other reproductive cancers. HPV testing works by detecting the virus's DNA in tissue samples from areas like the cervix or anus. It is much more sensitive than traditional Pap tests at finding high-risk HPV types that could lead to cancer. When a test comes back negative, it means there's a very low chance of developing serious HPV-related issues in the next several years. This gives individuals peace of mind and helps healthcare providers decide how often screening should happen. The real power of HPV testing lies in its ability to identify those with persistent high-risk infections. When someone tests positive for these types, they can be monitored more closely or treated early to remove abnormal tissue before it turns into cancer. This approach effectively breaks the chain of disease progression, preventing invasive cancers from developing. For example, regular screening with HPV testing every 5 years for women over 30 has been shown to significantly reduce cervical cancer cases and deaths. While HPV vaccination is a major prevention tool, it doesn't cover all high-risk types. That's why screening remains essential. Vaccinated individuals can still get infected with non-vaccine HPV types, so testing helps catch these cases early. Plus, HPV testing has expanded access through home testing kits, making it easier for people who might not visit clinics regularly to stay protected. This is especially important for reaching underserved populations and reducing health disparities. In terms of reproductive health, HPV testing is vital for early detection of risks related to HPV-associated cancers. For women, starting screening at age 30 and continuing every 5 years if results are negative offers long-term protection. For men, especially those with persistent infections, testing can guide closer monitoring, although routine penile cancer screening isn't common yet. The key is that early detection through HPV testing allows for timely intervention, which can prevent the development of invasive cancers and save lives. It's also important to remember that HPV testing has limitations. It detects persistent infections but can't tell if an infection is new or long-standing. Sometimes, a positive result might mean a recent infection that could clear up naturally. That's why healthcare providers interpret results carefully and recommend follow-up actions based on individual risk factors. Using FDA-approved tests ensures accuracy and reliability, so always consult your healthcare provider about your screening options. In summary, HPV testing helps reduce transmission risk by identifying those carrying high-risk types early on. This enables timely treatment and monitoring, preventing the progression to cancer. When combined with vaccination and safe practices, HPV testing is a cornerstone of effective prevention strategies. Remember, staying informed and getting regular screenings, as recommended by health authorities, is the best way to protect yourself and those around you from HPV-related health issues. Always seek personalized advice from healthcare professionals to make the best choices for your health.